Do you see any reaction?
Oh, okay.
So if you press reaction, there should be raise hand button,
Okay.
and that will allow you to let other people know if you have any questions.
All right. Cool. Thank you. I feel like I'm just gonna start. There's only 3 people, including the IT person, or there's more coming. Hello. I'm trying my best to speak louder, but I don't know if you can hear me.
Yeah, we can hear you. We can hear you clearly. We just, I believe
Yeah.
other people like me also increased our volume on our end. So, but later on, I can assist you on that to increase the volume on microphone volume on your Mac.
Okay. Thank you.
Yep.
Yeah, I'm just worried. I don't want to be just talking to myself.
We can
No,
hear
no,
you
no.
clearly.
We can hear you. Yeah,
All
we
right.
can hear you.
I don't know how long we have to wait. I'm just gonna start because I just don't want to waste others' time. Oh, there's more coming. So I'm just gonna start. Hello everyone again. This is Gadise. I'm a respiratory care student at Seattle Central College. Before I start my presentation, I'm going to ask you some question. You can raise your hand or chat with me to answer the question. Or if you have any question, you can chat or raise your hand later on. So how many of you knew about respiratory care? Or did you know anyone in the field or in the program already? Is that a yes or no?
I'm not in the program. I'm looking around what's gonna fit me.
Okay, nice. You're in the right spot. So before I start with my presentation, I'm just going to tell you about my background information, how I ended up in respiratory care program. Um, about 8 years ago, my family and I we came to America as immigrant. Immediately, I started school. Obviously, as you can tell, English is not my first language. I actually speak 5 different languages. So coming back to the point, I started ESL class level 4, and then the next quarter I joined level 5, and level 5 was the last level that you can do. And then you transition to college. Uh, so I couldn't apply to financial aid because I didn't have high school diploma. Then I started taking high school 21 plus at Highline College. Then at 2017, I got my high school diploma, and then I applied for college classes. And then, like, I started taking college classes like English 101, communication, biology classes. I knew I wanted to do something in the healthcare field, but I didn't know where to start. Uh, Luckily, one of my church friends, she was already in the program at Highline College. She told me, "Why don't you do respiratory care?" And I was like, "What is it?" And she told me about it. And then from there, I started researching. And then I saw Seattle Central College offering the program about 2 years. I knew Highline offered for 3 years, and then I went to the information session at Seattle Central College. Then that night, I couldn't sleep. I applied to the program. Luckily, I got into the program. Um, and here I am today, about to graduate with Bachelor in less than 2 months. So, respiratory therapist. As a respiratory therapist, I know once you get into the program, you might get this question a lot. Like my parents, they see me as a nurse when I wear a scrub going to clinical. They're like, "Can you look at this medication? Tell us what it is about." I'm like, "No,
It's 18 hours.
Sorry, and I only treat patients with breathing problems. So a respiratory therapist apply critical thinking, patient environment assessment skill, evidence-based clinical practice skills, develop, implement, and modify patient care plans, follow patient-driven protocols, utilize disease-based clinical pathways, implement disease management programs, perform therapeutic and diagnostic procedure. Like in summary, respiratory therapists work as a physician extenders to evaluate, treat, and care for a patient with lung and circulatory disease disorders. Um, So, what breathing disorders do we treat? We treat asthma, bronchitis, emphysema, COPD, cystic fibrosis, chest trauma, pneumonia, and so on. So you might be wondering what kind of oh, here someone. Okay, I'm just gonna mute that. I'm sorry. So you might be wondering what kind of patient population we work with. As a respiratory therapist, you can work with lung disease patients, cardiac patients, neuromuscular patients, accident victim patients, premature infants, children, adults, and then the elderly. So how do we treat? We treat patients by, as you can see, on the on the right side, maybe it might be on the left side on you guys' screen, the person with the big machine that's ventilation, mechanical ventilation. So we insert tube by, we intubate by inserting tube through their mouth down to the windpipe to breathe for them. We monitor breathing and other vital signs on the ventilator. We take blood to check their oxygen levels and other results. We give medication through mist, dry powder, or other inhalers. We taste how well their lungs work, including how deeply a patient can breathe. So where do respiratory therapists work? People might say, oh, a respiratory therapist, they only work in the hospital. That's not true. Yeah, we work in the hospital, but we also work in diagnostic laboratories, rehabilitation in a skilled nursing facility, patient homes, patient transport services, physician offices, education and research. Especially like this program offers a Bachelor, and it's a good transition if you want to advance your education, become a PA, get your master, or if you want to do like be a clinical instructor, and so on. So at this point, you want to know how much a respiratory therapist make. Employment of respiratory therapists is projected to grow 23% from 2020 to 2030, which is much faster than the average for all occupation. I did do research only for Washington because I want to work here in Washington. The median annual wage for a respiratory therapist was $62,810 in May 2020, and higher in Washington state. So I know this is in 2020. This is the earliest evidence that I got. Like, you know how COVID changed everything. It might be higher. I know a lot of hospitals, like they start like 35 and higher, or 32. So which is a good field to make money. So what does our life looks like as an RT? I'm just going to tell you my experience as RT students, my clinical rotation. Usually an RT gets about 6 to 10 adults patients, and 4 to 6 pediatric. I only had 4 adult patients last quarter, a heart review, and 4 pediatric patients, which is I'm working right now with Children's Hospital. On the top of that, you also have to respond to code blues because you are always on the head of the bed monitoring patient ventilation. If patient is not intubated, which means it doesn't have a tube and doesn't have the mechanical ventilation next to them, you might set up the equipment for the doctor to intubate the patient. Or some places RTs do intubate, like Providence. I know my one of my instructor, he does intubate at Providence. And then if you've never been in the healthcare field before, code blues might be a little bit challenging. My experience, I never been in a healthcare field before. My first code blue was at Swedish First. So that patient didn't make it out, and I was in tears. I was very emotional, but I learned that how much teamwork is important to save life. Of course, there are many code blues that we successfully saved, and that's that person's life, and that's a proud of moment, you know. I know at this point you might ask yourself if respiratory care field is the right field for you. I can tell you that as a respiratory therapist, you can provide a great job at good salaries, job security, the opportunity to help others if you love to help others, recognition, respect, and appreciation, sense of accomplishment, a rewarding career for life. If you want to join the respiratory care program at Seattle Central College, there are prerequisites you have to take before you apply to the program. It might not be really, you cannot see, I know it might be really small, but I can read it out for you. You have to take biology and 160. Can you guys see the screen? Like, can you see the prereqs?
Yes,
Oh,
I can see them.
yeah, so you have to take general biology, AMP 1 and 2, micro, and introduction to statistic math. If math is not your thing, don't be scared. I can only count my money. I don't know anything, but I survived in the program. They will teach you good. They're really good. There is a little bit some math you have to do in the program, like calculating patients' body weights and stuff, but it's very kind of algebra math. So also you have to take Chem 1 and 2, chemistry, English 1 and 2, psychology, humanity class. And the one you see at the bottom, those are, once you get into the program, they will offer you in the program, like cohort starts like spring and the actual program starts in summer, I believe. You have any questions?
Respiratory care is 4 years pathway, right?
It is, yeah, you have to take the prereqs. Let's say I was a transfer student, I took everything at Highline. I did all the prereqs at Highline, so when I transferred, it's actually 2 and some quarters. It's like 7 quarters. The first one is called the cohort. You just, it's kind of introduction classes, like medical terminology classes. But yeah, it's a 2 years program. Did I answer your question?
Yes, thank you.
Okay, thank you. And if you have more questions, you can contact Jen Clark. She's the director of the program. Here's her email and her phone number. Or if you have the QR, you can take a look at it more in detail in the program. And thank you. That's all I have. I know I didn't put it here on my PowerPoint, but I would like to share with you guys. Once you finish the program, so what do you do next? If you were interested in nursing and you looked at the nursing program, I know at the end of the nursing program, after you graduate, you have to take NCLEX. For us, after you graduate, to get your license, you have to take 2 exams, which is the first one is the TMC, which is a multiple choice exam, and you pass with high cap. You sit for the next exam, clinical simulation exam, and then from there you get your license and you apply for jobs. And that's all I have for you. Please let me know if I didn't cover everything or if you have questions so I can answer your question.
No, I don't have any questions. Thank you for the information.
You're welcome. You can contact Jen or here's her phone number.
Okay, I took a screenshot of it.
Oh, okay. Here's the QR.
Thank you. You have a wonderful evening.
You too. Thank you for coming.
No problem. Bye.
Bye.
Thank you so much.
You're welcome.
Okay. Hey, so if anyone has any question, let's say, will they go back to a general meeting or they will use a QR code that you generated to move forward?
If they have more question, there is information. Jen Clark, her phone number and her email, and the QR is about the program. It will take them.
Program, okay.
Yeah.
Perfect. I just wanted to make sure, like, do I need to move them back to the general meeting? I guess they disconnected. So we should be good. Yeah.
Okay. I don't know if I need to stop sharing and then go back to the meeting.
Yes, our session is done. So yes, we can do that because I'm about to close this one.
Just stop sharing, right?
Yes, stop sharing. Stop sharing will allow you to just like stop sharing the screen, but go ahead and close the session. Do you see any close room button or leave room? There should be leave room.
For some reason, leave room at the bottom. Yes.
Yeah.
So, okay. Thank you.
Yep. All right. Bye.
Are all the people in this room presenters and organizers?
I think it's a mix. I think some breakout rooms are wrapping up.
Okay.
We've got 5 more minutes in the breakout rooms. Is there anyone in the room currently who has any questions about Seattle colleges or our programs? We have a little bit of time to answer those questions before everyone comes back. Feel free to use the chat or come off mute. We'll be here.
Okay. We are all together. Right, Rachel? Because,
We have 1 more minute until I'm gonna close the room.
oh, okay. Okay, I was, sorry, I was a little bit fast on the gun.
That's all right.
I was like, everybody, we're in the room. But you know, this is great because I had quite a lot of questions, Rachel, from everyone in the room. Thank you, everyone in the room, by the way, for suffering through with me in all of the knowledge that I had in my brain about nursing. And I really want to give a big shout out and thank you to Sierra, who's been helping prospective students like you every single day do the process to get into nursing and all those requirements and all those deadlines and all those prereqs. Rachel, I want to ask the question, one of the biggest questions I got that I wasn't sure. I wonder if you know the answer to. Students who, so nursing is popular and it has a waiting list, and not everybody who applies to nursing gets into nursing, as we know. And there's kind of two questions. One is, do you know how they go about picking which students get into which quarters? Do you know if it's more of a lottery? I've heard the concept around a lottery system where they just do like random picking based on everyone, but I've also heard a strategy around based on when you applied, they kind of sometimes just take the first chunk of people and then next quarter they'll offer the people who didn't get in the previous quarter first. What do you happen to know?
I don't, unfortunately. I do know that there are certain requirements that students have to meet when they apply, like getting a 75% or higher on the TEAS test. And there's also the GPA requirements. I believe it's 2.5 on all of the
That's right.
classes.
We went over all the requirements, so we're good
Okay.
with all the requirements.
All
It was
right.
just around, yeah,
How they
around,
select the cohort.
Yeah.
Yeah.
So
I
there's
have
no-
heard the lottery system as well, but I can't say for sure.
yeah, me too. Okay.
Lydia, did you have
Hey,
your hand?
Yeah, I was just going to say, I know that a big determinant is getting all of your paperwork in and completed. So last time I talked to Jordan Bachelor, it was the one who was advising for that, or like doing the admissions advising. And he said that not only do you have to have like your transcript evaluation form in, but it has to be like evaluated and things. So get your paperwork in ASAP, because if it is this competitive, they aren't going to even put names that aren't complete into that lottery.